Hello, everyone. My name is Darian Livingstone. This is our second webinar here presented by Ceres Industries. You may notice that it's a little different from the original one if you did attend. The reason for that is when I reviewed the video footage, for some reason it didn't start recording until a few minutes in. So I just decided to re-record it so that everything was really concise. And that way nothing is missed as well. So with that, we're going to get started with the actual presentation. My name is Darian Livingstone. I'll be your presenter today. I do want to mention that I am not an equine nutritionist by any means. I'm actually a ruminant nutritionist. However, I have done a significant amount of research of my own. And not to say that I am an expert by any means, but I definitely think that I have a good foundational knowledge of equine nutrition. I just thought that I would mention that there. So to get started, we're just going to go over a little bit of background information in terms of the horse itself. So horses actually evolved from their prehistoric ancestors to be foragers and grazers. Their GI tracts evolved to be able to digest and hold bulky feeds that are quite fibrous in nature, and these are normally found on really diverse rangelands. Some typical grasses that you might see would be slewgrass or brome, some timothy, any kind of native pasture would be a horse's typical diet back in the prehistoric eras. Back then, a horse's daily agenda was very simple. Their main goals in life were to eat, make babies, and run from the occasional predator. So they didn't really have the nutritional requirement that a horse today might. Today, however, we have a much higher expectation of our four-legged companions. We enter them in rodeos and jumping competitions. We use them for ranching and other work tasks, and we also take them out on quite lengthy pleasure rides. This extra demand correlates to a higher nutritional demand from our horses. So to compensate for this, what's been done is often people will start to include concentrates in their diet, and typically that's in some form of cereal grain, usually oats. Along with this, we tend to keep our horses in confined areas, such as stalls and small paddocks, because it makes the horses significantly easier to catch when we need them. And quite frankly, even pastures can be considered a confined area when considering how the horse has evolved, because that 160 acres that's within that pasture has a limited number of forage species when you consider an entire mountain range or an entire mountainside that some of our endangered wild horses are grazing on. Being in this confined space removes a horse's ability to be a selective grazer, choosing only the young and immature forages that can be digested most efficiently. So horses out in the wild, they'll typically go through and they'll pick out the grasses that are really young and tender and are quite leafy still. These grasses tend to be very easy for the horse to digest. However, being in a confined area, they're often only given stored forages such as hay, and obviously with that being the only choice they have to kind of take it or leave it. And if they're in a pasture, they'll have to just kind of eat everything that they can since they don't have an unlimited menu. So with these changes in a horse's lifestyle, horsemen and horsewomen really need to determine how to meet the needs of their horses in a way that the horses can safely consume and use those nutrients without being put at risk for some digestive complications. One of the best ways to be able to feed your horse in that way is to begin understanding how the equine GI tract is built and how that works. I also would like to touch on the difference between physiology and anatomy. These are often taught in courses together, And so they can be quite confusing in terms of what each of them means. I know in some instances they're actually used interchangeably. However, that's not actually correct. Their meanings are different. So physiology is how an organ or a system functions. So here I have an EKG chart that is denoting when a heart is contracting. So the heart receives a signal from the brain, which is turned into an electrical nerve impulse, and then the four ventricles and atrials contract in sequential order, which pushes the blood through the heart and out through the arteries. The anatomy, however, refers to the structure of an organ or an organism. So whether that's the shape, the size, the color. For example, the anatomy of a heart means that it has 4 chambers, 2 ventricles, 2 atriums, and a set amount of veins and arteries coming off of that. So the physiology is the function or how something works, and the anatomy is how it's built. We're going to go through the rest of the webinar referring to both of these aspects of the GI tract, so I just really wanted to make sure that those two terms are clear and how they're different. A brief overview of the horse's GI tract. So a horse is termed a monogastric, meaning that it only has one stomach, very similar to pigs or humans. Whereas a cow has a 4-chambered stomach, a horse only has 1 chamber for its true stomach. Horses are unique in that they have dual modes of digestion. So within the stomach, we have that foregut enzymatic activity, very similar to how humans digest with pepsin and amylase and all that good stuff. But then when we get into the hindgut, they actually mirror how a cow digests, and they perform hindgut fermentation. So here we have microbial activity fermenting and digesting the appropriate nutrients and breaking them down into their subsequent parts for the horse to use. The physiology of digestion includes processes that break down complex feeds into simpler and more usable substances. So for example, we intake protein and digestion takes over and converts that into amino acids, which are then used by that organism for a variety of functions. We'll be talking about these processes as we continue through the horse's GI tract. Now, just note, we're not going to get into super great detail because this is kind of a beginner's very short overview. I don't want to get too nerdy on it and cause extra confusion for some of those who may not have that background education. We can always go plan in the future to have a more in-depth one for sure. That will be a question on the survey that you will all receive at the very end here. So the foregut, I think it makes sense to start at the beginning of this digestive journey. So beginning with the foregut, which consists of the mouth, the esophagus, the stomach, and the small intestine of the horse. Mastication, or the act of chewing, is the first step in this journey that we're taking through the GI tract of a horse. I'm sure you all know that horses have these very expressive lips that can be used to gather hay or grasses before they use their teeth to rip it from the ground or the feed manger. So they kind of grasp the hay or the grass almost like little fingertips to hold it still, and then their teeth will chomp down and pull it up. The structure, or the anatomy, of the front teeth act as knives for ripping and tearing the feedstuff from the earth, while the back teeth are made for grinding the feed into smaller and more manageable pieces. Horses have a complete set of upper and lower teeth, unlike cattle, so they don't tend to chew side to side, much like cattle. They actually tend to chew in a forward and backward sweeping motion. The number of chews it takes to properly grind down a feed is totally dependent on the type of feed stuff. So because hay is a more fibrous feed material, it will take more chews to break that down than, for example, oats. The more chews that a horse takes, the more saliva is generated, which allows for proper lubrication going down the esophagus. Saliva also contains a very small amount of amylase, which helps to break down those carbohydrates prior to them entering the stomach. But it also is really important in terms of playing as a buffer once that food enters into the highly acidic stomach. I just want to make note that horses that are receiving large amount of grains tend to have uneven wear on their teeth, which can result in hooks and sharp edges. Horses that develop these, will have a more difficult time or a nearly impossible time chewing their food, since it can be quite painful for them. If you have a horse like mine, that means that she'll likely just swallow her food whole. However, some horses will just refuse to eat altogether. Now, obviously, both of those are a problem. If your horse becomes anorexic, then they're going to be quite frail and unthrifty. But if your horse is like mine and chews its food whole, then you can run risk for impaction and blockages throughout that GI tract. So it is really important to make sure that you're keeping up with that floating. I just wanted to include this little fun fact. So female horses have 36 teeth, whereas male horses only have 40. I didn't exclude the wolf teeth in this count simply because not all horse breeds have them. But basically the bottom line is that male horses have more teeth, which I thought was cool. Now we're moving into the esophagus, and this is arguably the most simple organ within the GI tract. It's literally just a 1.5 meter tubular muscle. The esophagus it runs from the horse's mouth down into the stomach. It pushes the food through via peristalsis, and what that is it's just the sequential contraction of those muscles. So the muscles will begin contracting up here and follow the food bolus, and they'll just contract all the way down, pushing that food digestia into the stomach. Because horses have a limited ability to vomit or have acid reflux, this can lead to incorrectly chewed food, as I mentioned on the previous slide, becoming lodged, which can cause choke. So again, I just really want to reiterate that you do need to have your horse's teeth properly floated. Sometimes even if you have a horse who just inhales their food because they're such a pig, you can also add large stones or baseballs to their feed, obviously large enough that they won't try to eat them. But basically what it does is it kind of puts some obstacles in their feed majors that they have to maneuver around, which can slow them down a little bit. I honestly have to do this with my dogs. It seems to work reasonably well. I've seen people do this at rodeos with their horses just to prevent them from eating too fast before a competition as well. So going into the stomach now, this is the second last part of the journey through the foregut of a horse. The capacity of a horse's stomach is quite small considering the size of its body. In terms of domesticated animals, it's actually the smallest ratio of all of them. This is because, as I stated at the beginning of the webinar, horses have evolved to be grazers, and since there's no fermentation occurring in the stomach, it doesn't need to have a huge capacity. So within the stomach, we have enzymatic digestive activity. So we'll have a little bit of amylase in here and some pepsin, which are both responsible for digesting our food. Amylase digests carbohydrates, whereas pepsin digests proteins. But the rate of passage through the stomach is very speedy because, like I said, there's no fermentation. Again, the rate of passage through the small intestine is equally as speedy. So really the journey through the foregut is quite quick for a horse. I didn't give exact times because it does depend a little bit on the breed and size of horse. But just know that it can occur as fast as 3 to 4 hours from the time that a horse takes that food in to the time that it exits the small intestine. Because of this quick rate of passage, horses are often seen constantly eating, which is often why they're termed hay burners, and I truthfully will not say that name is not warranted. When horses are fed larger meals, their stomach, can become quite distended, which can cause abdominal pain. So if you aren't allowing your horse unlimited access to hay, sometimes they don't understand that they have to ration themselves, and they just see that feed and they gorge on it all at one time. This can cause that abdominal distension. So if you are going to limit feed your horse, I would definitely recommend feeding them in at least 3 separate portions throughout the day. So feeding them morning, noon, and night. The stomach can be quite prone to ulcers on its upper portion. So the stomach is divided into 2 areas. The bottom portion has this really nice protective lining on it and does a lot of churning. That's where the hydrochloric acid and pepsin are secreted. The upper portion, however, is really just a smooth, unlined area. And so when we have empty stomachs that are empty for a long period of time, that can really eat away at that unlined area of the stomach, which can create ulcers. Ulcers can be quite dangerous because they are a hole from the stomach that leads directly into the bloodstream. So if you have any toxins or anything that's coming into the horse through obviously feed intake, that can enter the bloodstream and be distributed throughout the body, which can be quite costly, to be honest. There's also some research that suggests a high amount of exercise can cause ulcers, and the reason for that is because all that shaking around when a horse is moving can increase the gastrointestinal pressure, which can then cause an ulcer. So really the best way to prevent ulcers is making sure that that stomach constantly has something in it. So again, providing your horse a round bale for unlimited feed, or making sure that you're dealing out at least 3 rations per day if you are limit feeding. The small intestine. Now this is the last part of the foregut of the horse. The small intestine represents about 1/3 of the total volume of the GI tract. It's divided into 3 sections: the duodenum, the jejunum, and the ileum. And depending on who you listen to, those words will all be pronounced very differently. I find that they roll off the tongue easiest when I pronounce them the way I just did. It's just kind of a preference type thing. The small intestine is lined with villi, which are meant to increase the surface area for nutrient absorption. Villi are finger-like protrusions that are all over the small intestine. They're quite small, but the purpose of them, like I said, is to increase the surface area because it creates these folds and bumps and ridges that the food can be absorbed through. So the main function of the small intestine is to continue to break down digestate coming in from the stomach into smaller particles and beginning the nutrient absorption. The villi are responsible for this nutrient absorption and bringing nutrients into the bloodstream. The beginning parts of the small intestine, the crypts of Lieberkühn, also secrete digestive enzymes responsible for breaking down carbohydrates, fats, and proteins. These are then turned into sugars, amino acids, and fatty acids, as well as a variety of vitamins and minerals, which are then transferred across into the bloodstream for distribution around the body. So here we start to see the beginning of nutrient absorption. The hindgut of a horse. So this is the site of fermentation. This is the portion of the horse that is very similar to ruminants. So like I said, the large gut is the site of fermentation. However, in contrast to sheep, goats, cattle, and other ruminants, horses ferment their food after their stomachs, which is where the term hindgut comes from. This is really advantageous because it gives horses a second chance to obtain nutrients from their feedstuff. However, the microbes in the hindgut are meant for fiber fermentation. So when large amounts of sugars are received, for example, in an oat diet, the horse is more susceptible to digestive upset. And this is because, just like in cattle, where we can see that bloat occurring, that occurs in the foregut of that cow. And cows have an ability to eructate or burp and vomit and such. Horses do not have that ability. And due to the anatomy of the cecum, which is the site of fermentation, it can be really prone to bloating, blockages, and impaction. So if you are feeding your horse oats, I would really recommend that you speak to a nutritionist and make sure that your horse does need that higher inclusion rate of starches and sugars. Otherwise, feeding a high forage diet is highly recommended for your horses. There's also quite a bit of research that suggests hindgut fermenters have the ability to be thriftier in subpar conditions than a foregut fermenter because they can consume lower quality forages all day long. And because the hindgut really gives them a second chance to absorb those nutrients, they tend to be just a little bit more efficient in terms of how much they absorb versus how much they excrete. A fun fact, rhinos and elephants are also hindgut fermenters. I did not know that. I assumed they were just normal monogastrics, but I am not a zoologist, so. The large intestine, there are two main purposes that the large intestine has: storing and absorbing fluids, as well as microbial fermentation. And that's really where we're going to kind of hang out for a little bit because it is quite important. So these two functions are really important because they help maintain the electrolyte and fluid homeostasis within the horse. So just making sure that everything is being balanced and maintained correctly. Homeostasis, if you don't know, that literally just means being balanced within a system, a bodily system, and balance is really important. The large intestine begins with the cecum, which is a blind-ended sac located on the right side of the abdominal cavity. Being blind-ended simply means that the entrance to the organ is located very near the exit. So if you look at this diagram here on the right, the entrance to the cecum is right here, while the exit is literally right beside it. So when the digesta enters, it'll come in here, it'll rotate all the way down, back up and around, and then exit through the hole right beside the entrance. This hole is actually only about 3 to 4 centimeters in diameter, which makes it a huge risk factor for obstruction and impaction. The anatomy of the cecum, however, allows for digesta, especially long fibrous portions, and that would, hopefully be the main portion of your diet, would be those long fibrous hay portions. That allows them to spend a long time in there to be adequately digested and fermented by those microbes. In some instances, some particles may actually spend 3 to 4 days in there being properly fermented before moving on. So the cecum is a quite motile organ. It tends to move and squish around a lot. And then every once in a while, it'll do a really big contraction and squish out some feed into the large colon, which is the next organ that we're going to be talking about. The primary function, or the physiology, of the cecum is to allow for slow fermentation by the microbes to occur so that appropriate nutrient absorption can occur. So within the microbe, there are billions and billions of bacteria and protozoa, which break down the carbohydrates via fermentation. Microbial fermentation results in B vitamins being formed, as well as vitamin K and volatile fatty acids, which are then used in the energy production cycle. There's 8 B vitamins, which have roles in energy synthesis, metabolism, and brain function, as well as immune function and the vigor of skin, hooves, and hair. So I'm sure all the women listening have heard of Nature's Bounty hair, skin, and nails. That is a mix of vitamin Bs that help your hair and skin and nails to grow and be very healthy. And that's kind of the same thing that's going on here. And vitamin K is very crucial for blood clotting, as well as the maintenance of healthy bones and bone metabolism. Volatile fatty acids are used by the horse to derive energy. Acetate is the most important one. It's especially important in brood mares since it's an important source of fat in the mare's milk. The reason acetate is the most important one is because that one can be used directly as energy, whereas butyrate and propionate need to go through some additional steps to be turned into energy. Acetate is derived or pulled from, forage-based diets. So research has shown that mares on forage diets have higher milk fat percentages than mares on concentrate diets. And that's a neat point because that is really where that foal will be getting a lot of its nutrients. So when you have a higher milk fat percentage, that's just extra energy extra energy and nutrients for that foal to thrive throughout its growing period. As I mentioned, the large intestine is quite motile, which serves to mix the ingesta, which is done by peristalsis and antiperistalsis. That mixing is really important because it makes sure that nothing is kind of stuck in the middle being undigested and simply moving through that digestive tract. That's not very efficient. So the ascending colon is the next portion that we're going to be talking about. So if we go back to this photo, this is the cecum. It's quite large. It sits on the right side of the abdominal cavity. And then we have the colon. We have the large colon, and then we have the small colon coming down over here. So the colon really kind of squiggles left and right across the abdominal cavity before we get to the rectum. The ascending colon, also termed the large colon, consists of the left and right ventral colons, as well as the left and right dorsal colons. These sections will contract and efficiently mix ingesta while exposing it to the mucosa for absorption of water, electrolytes, and any volatile fatty acids that happen to escape the cecum. There's a small degree of fermentation that still occurs within the ventral colons. However, it's a very small amount. Primarily, that's all done in the cecum. The transverse colon is a constricted portion that travels from left to right, joining the large and small colons. So this portion needs to pass through the pelvic flexure, and it actually narrows down quite significantly, which makes it a really high-risk spot for obstruction and impaction. So again, we really need to make sure that we're feeding feeds to our horse that the microbes can appropriately ferment and digest so that whole foods aren't being passed on. Once we start to feed high sugar diets, that microbial population shifts to become a different species. That's where we start to see an increase of gas production. We start to see more whole seed kernels being passed through the digestive tract. So again, making sure that your horse has a significant amount of fiber in its diet is very important. By the time the ingesta reaches the descending colon, or the small colon, nearly all of the nutrients have been digested and absorbed. Anything that remains at this point is indigestible by the horse and on its way to excretion. The goal at this point is simply to retain any moisture and return it back to the body. And at this point in the journey, the ingesta is being compacted into fecal balls and prepared for excretions through the rectum and anal cavity. So that is the quick version of the horse's GI tract. Like I said, it's very basic. I didn't go into too much detail here. I also want to just quickly touch on colic. This is one of horse owners' biggest concerns, and it is directly related to the digestive tract. So I did want to just quickly go over this. Colic is actually a broad term for a condition. It's, a broad term for a symptom. It's not actually a condition. Colic is simply a symptom of abdominal pain rather than being a disorder itself. The symptoms of colic are very obvious, that there's pain within the horse's abdomen somewhere, but it's not possible to determine where that pain is coming from without a thorough examination from your vet. Since diagnosing colic accurately can take some time, it's really important that you can help provide them with as much information as possible. So when you notice some of these colicking symptoms, kicking at the abdomen, lying down, rolling from side to side, which is sometimes called casting, sometimes you'll see horses stretch as if to urinate. Basically, it's really obvious that there's some kind of discomfort within that belly area. When you notice these symptoms, it's time to start taking some notes on your horse so that when you do call the vet, they can come up to a reasonable diagnosis quicker. So some of the things that you should be noting are the length and speed of progression of the colic episode. So if you notice that your horse is, a little uncomfortable Friday night, maybe you think they just need to fart, and then the next day they're starting to roll around, then that can be a good timeline to give your veterinarian. However, if your horse is fine 1 minute and immediately casting itself within 10 minutes, then you know that something is significantly wrong and the vet should be out there ASAP trying to do some ultrasounding to find what I would assume is a blockage. Horses with colic may or may not need surgery. Oh, excuse me, I should really finish that list. So the length and speed of progression of the colic episode. You also want to mention the severity of pain. Obviously, you can't ask your horse, but it's pretty obvious to how dramatic they're being when they're doing these things. You need to note if any feces have passed. So it might be possible or sensical if you have a horse that you notice is colicking. If you put them in a clean pen, and then you can note as time passes if there's any manure piles to make sure that feces are actually being passed. If not, then that's a really good indication that there's a blockage somewhere. Noting the deworming history for your vet. Sometimes parasites can cause blockages when the teeth were floated last, and if there's been any recent and sudden changes in the feed that you're giving them. The type of colic will determine the type of treatment. So as I said, not all horses will need surgery if they're colicking, but most of them will almost always require some kind of medical treatment. A twisted gut or a mechanical blockage will likely need surgery. However, if it's a functional colic, which simply means that one of the organs isn't quite working the way it should, often that will be able to be treated by some kind of injection. A mechanical colic, however, means, as I said, that there's a blockage somewhere, whether that's a twisted gut or an impaction somewhere down the line. Those are often really hard to get rid of with just palpating, so quite often surgery is needed. I do have a list here of some of the types of procedures that a veterinarian will perform when diagnosing colic and why they're doing that specific procedure. I'm not going to read all of these out, but when you're rewatching this video, feel free to pause and read up on them. And this is why it's really important to make those notes for your veterinarian, because as you can see, there's quite a few procedures, and some of them can be quite timely. So if your vet has to go through this entire list, that can take up a lot of time, and time can really be of the essence depending on the severity of the colic. So explaining to your vet that your horse hasn't had a fecal movement in, X amount of time, that maybe can lead him to starting with a rectal exam and an ultrasound rather than inserting the nose tube and all of those things. So it just gives him or her a place to start rather than playing a guessing game. So in conclusion, feeding horses as close to their natural diet as possible. And I've said it several times throughout this webinar, but I'm going to say it again. The natural diet of a horse is high forage. We've come into this era where people think that their horses need these fancy supplements and oats and all that good stuff, but a horse can thrive on a plain grass diet. In fact, they're really built for it in comparison to consuming oats. However, if you have an athletic horse that's performing at top notch, and when I say a highly athletic horse, I mean almost 10 hours a week of performance. If you're pleasure riding 1 to 2 hours a week, that's not an athletic horse. That horse will survive on grass. But if you do have an athletic horse, I would highly recommend speaking to a nutritionist to determine at what inclusion rate those oats should be included into the diet at. And definitely, you need to be making sure that those are being provided in multiple rations per day so that we don't overload those cecum microbes. In addition, if you're feeding those concentrates, you do need to be supplying adequate forages at all times, and I would highly recommend that being a free choice system, not limited fed. I do want to just take a moment about the forage aspect. If you have a horse in a stall, I know hay nets hung up on the rails really keep things nice and tidy and looking clean. However, the act of a horse putting its head down to the ground to feed stimulates a reaction within the brain, causing a horse to salivate. That increase in saliva production really helps lubricate that GI tract, especially the esophagus. So I would highly recommend putting that hay on the ground so that your horse can have adequate lubrication for swallowing and preventing choke. I know that's going to mean a little bit more work in terms of cleaning, but just remember that you are a horse owner and responsible for that animal's health and welfare. Horses should always have access to clean, fresh water to prevent complications. Keeping your horse hydrated is one of the best preventative measures for preventing colic, actually. Keeping that food bolus and digestive moist as it goes through the GI tract can really help prevent blockages and any kind of impaction. So that's all I have for this webinar. Obviously, here's my references if you are interested. Obviously, there's not the ability for you all to ask questions since this is a post-recorded video. However, if you do have questions, you can always email them to me at dlivingstone@ceresindustries.com. You can also find us on Facebook and Twitter. Feel free to send us a message on there. During the actual webinar, we did have a lady ask the question of if you can feed alfalfa to your horses and the recommended rate of inclusion for that. So alfalfa is a totally fine feed ingredient for horses. It's high in protein. It has a ton of vitamins and minerals. It does tend to be a higher sugar hay. So I would say that this is a really good hay if you have a horse that's higher performing, but doesn't quite need that inclusion of concentrates. In terms of the rate of inclusion in the diet, horses typically will consume about 2 to 3% of their body weight per day dry matter of feed stuff. But if you are concerned about the level of sugars that's in alfalfa, you can always talk to a nutritionist to see what your horse actually needs. Also taking a step back and looking at what your horse or how your horse reacts to certain feeds is really important as well. Cattle seem to be really easy in that what you feed to one cow, you can feed to all cows. Horses tend to be like humans who have a variety of dietary needs and can be quite finicky. Some horses look at grass and tend to founder. Some horses, like mine, can eat silage out of the feed bunk with cows. So understanding how your horse reacts to certain feed stuff is really important as well. That's as best as an answer that I can give you without knowing your horse personally or looking at what else you're feeding it. But alfalfa, we feed our horses alfalfa cubes. It's a treat that you can buy at the pet stores. There's really no reason that you shouldn't be able to feed a bale of alfalfa hay, provided that you know that the horse needs those additional nutrients, and that those higher level of sugars won't cause some complications such as laminitis or founder. Anyways, that's all the questions that were asked at the webinar. So either that means I explained things really well or I confused you all. And I hope it was the former. So I will leave you with that information. Feel free to ask any type of question you have. Connect with us on social media. And I hope you all have a great day and a Merry Christmas.